Awesome. Wow, just instant right. Okay, so I'm just going to touch base briefly on the Self-Direction Act of 2022. Most of you were big supporters and helped us along with our two sponsors, Karen Lewis Young and Susan Lee. And so we were really thrilled that we had all of your support and that the bill passed. It was not signed by Governor Hogan, but it is passed. And we look forward to continuing to work with DDA and with you all to address all of the concerns and all of the changes that are afforded from this act. We have already started to work with them. The bill starts effective date October 1. And some of the changes actually have already started. Some will be in effect October 1, and some will have to wait for either a waiver amendment or a waiver renewal January 1st of next year. So next slide. And I will just kind of hit some of the highlights of what the bill key elements are. So it allows support broker hours up to 30 hours a month. That's certainly not have to, that is if you need it. And it increases the scope of work to whatever CMS allows a support broker to do. It also requires a support broker if a participant's family is hired as paid staff. It will remove the $5,000 cap for individual family-directed goods and services. It will require training of CCSs on self-direction services. It will require that everybody annually be told about all the options that are available to them, provider and self-direction. It allows for transportation reimbursement for specialized vehicles, and as of the webinar DDA did July 21st, we understand that is in effect now. So just anybody who had that as an issue, just be aware that it is now available. It does require continued parity in funding, so we're also grateful that we are now using this rate system. It does require transparency in process, which we hope to see shortly. In other words, being able to follow your plan, know that your plan's being submitted, see how it is progressing through the system, and transparency in all ways of dealing with DDA in terms of being able for the participant to be able to see what CCSs can see. It will ensure overnight supports and that family staff remain available. So some of these things will come out of the unallocated funds, which we've discussed on other meetings, but some of them will be new services such as the overnight supports. So I hope that gives you a little refresher on some of the things that the new bill will allow us to do. Next slide. So as I said, we have had 2 meetings with DDA to go over the intent of the act, discussions with DDA so that they can prepare to make whatever waiver changes are necessary in order to comply with the law. We remain committed to working with you, our members, and with the DDA to implement the new law. So we want to continue to hear from you on your opinion and things that you think would be helpful. Please never hesitate to write us at info@marylandsds.org and let us know what you are thinking, what's going well, what's being difficult for you to maneuver through. Today, if you have any questions, please put them in the chat and we'll do our best at the end of the meeting to address as many of those as we can. So next slide. And I think, Liz, you're up.
I have to unmute. Hi, everybody. Good to see you all. I'm Liz LaFrance. What I'm going to tell you is what we've learned from DDA. That's as accurate as today. Hopefully not too much will change. But so you'll see that FMCS, we have FMS in parentheses. FMS is Fiscal Management Services. They're changing that to FMCS, which is Fiscal Management.
Liz, can you speak up a little bit and a bit more clearly?
Sorry. It's, can you hear me now better? I have to shout a little. I'm very soft-spoken, I'm sorry, usually. So FMCS is Fiscal Management Counseling Services. It is the same thing as FMS, they've just changed the name. We're not sure what the counseling is, but that's the name now. So everyone, so right now there's, as you probably know, there's now 3 fiscal management services. There's the ARC of Central Chesapeake Region, which we've all had for a very long time. The MedSource is no longer going to be providing FMS services as of the end of the year. The 2 new FMSs or FMCSs are GT Independence and Public Partnership LLC. So GTI and PPL is how people refer to them. You'll have to, everyone will have to choose an FMS. Even if you want to stay with the ARC, you still have to proactively tell your CCS, your coordinator of community services, which one you want, even if you're staying with the ARC. Otherwise, or if you know who you want, otherwise one will be chosen for you, I assume at the end of the enrollment period, which is it starts August 1st and it ends November 15th. If you, so DDA is going to have information fairs. We have another slide that gives all the dates, and there'll be one that's virtual, one day. They'll have a morning session and afternoon session, and then there'll be one day for each region with a morning session and afternoon session, and the regional ones are in person. So August 1st is the virtual one. We really encourage you to sign up for that. Anyway, and try to go to a regional one if that's convenient for you as well. Let's see. And then on July 21st, DDA told us that the FMS fees will now come out of your budget. And what that means is, well, the important thing to know about that is they're going to put out a new budget sheet, which has a line for the FMS fees. Everybody will have to just transfer their current numbers over and add their FMS fees. So your CPS can help you with that. And if you also want to check with your CCS to be sure that your budget is funded with the increased funding that came out on July 1st. Not everyone got that. It's difficult to say if you did or didn't. So it's a good idea to check with your CCS to make sure you had those increased funding in your budget, because it's complicated, but just you'll want to do that to know that you have all the funds that you're entitled to. Okay, and then next slide, please. Okay, as I said, we have to choose an FMS between August 1st and November 15th, even if you choose to stay with the ARC. If you are with MedSource and you know you want to go to the ARC, it's probably better to do so sooner rather than later. What we don't know, and now Tracy Davis, do you know if you can switch like right away? We know that, so there's 2 start dates. There's to start the new fiscal management FMCS, October 1st and January 1st on the quarter of the year. But we don't know if you can. Tracy, do you know if you switch to the ARC now, can you start anytime, or do you have to wait till October 1st?
Hi, Liz. Sure. Yeah.
Hi.
So what we understand is that people would still have to make the election no matter what. And each individual team would determine when they would like to start and just start that transition process based on typically you based it on the quarter year.
Mhm.
So October 1 is a preferred start date, or at the end of the year. And that's just because of our accountability to providing payroll tax data to the IRS. So it tends to
Okay.
be on the quarters preferred. However, we have always accepted transfers based on whenever the team wanted to come over. They just have to coordinate that across the team and between the two FMSs. CCSs are highly involved in that process. Karen, do you have anything else to add there?
No, I would say, I totally agree with what Tracy just suggested. Oh my goodness. So yeah, I know we've already got some people asking about transferring over on October 1st. Definitely follow those guidelines. I know that some people also like to transfer over when their annual implementation date hits. Just makes it kind of easier with the plan and budget. So I would really coordinate with your CCS to see what's going to work best for the team.
Great. Thank you, both of you, Tracy and Karen, for those answers. One other thing I wanted to, so you have, as we said, we have to make a choice no matter what. There is, or one will be made for you. Don't assume that you're going to stick with whoever you are with. To encourage you to attend at least one of the DDA information fairs. And choose your start date of October 1st or January 1st. Now, if you change FMCSs, you have to submit new hire packets. So all your employees have to be rehired, basically, and they have to redo the background checks again. And the FMCSs need all your information 30 days in advance. So your team will have to not only give them the new hire packets, they also have to give them, they'll also need the plan documents, your PCP, your budget, which will be revised to have the FMS fees in it, the participant agreement, family of staff, all that stuff needs to go to the new FMCS 30 days in advance of the start date. So that really gives you a deadline of September 1st or December 1st. So earlier better. If you know where you want to go, just get it done as soon as possible. As I said, MedSource will no longer provide services after December 31st. And okay, next slide, please. So here are the dates. This email came out from PDA. We're going to follow up with you with the same information with an email today or tomorrow. So you have that. Every session you see is going to have two, one from 12 p.m. to 2 p.m. and one from 5 p.m. to 7 p.m. So when you click register, they'll give you the option to choose a time. So maybe sign up, things happen, sign up for the virtual one, sign up for another one. We just can't emphasize enough how much you should hear it right from DDA. And I think that's it from me.
All right, this is Patty again. So that is the one thing that, again, you need to pay attention to. If you're going to miss something. That's what these informational fairs are about, and that August 1st webinar is about. So if you miss those, you're going to have information that you did not get. And then you're going to be scrambling and you're going to be anxious and you're going to be asking, people for the information that you could have received. So try your best to get to that August 1st webinar one. And if not, one of those in-person ones, so you have an opportunity to hear from those three FMCS companies and you can get your questions answered. So again, I know I'm going to continue to repeat myself because I just know for a fact people will miss it if you're not paying attention.
Okay, Carol, is this you or this is me, I think. All right, so we did touch on the fact that when the new FMCS fees will be paid out of your budget. So this is just a heads up that if you need funds to pay for your FMCS or you have other funding needs, that you can talk to your CCS and your support broker. There have been rate and COLA increases as of July 1, 2022. Many people who already have approved plans were not able to use the July 1 rates. So if your vendors are going up, if you need now to pay for the FMCS, if you have other needs and you don't have enough in your unallocated funding, then I would talk to your CCS and support broker, because as of July 1, the rates did go up. So this is just like a tip of the day. If you need extra funding to look to the rate increases to get it. Next slide.
Hey, Alicia, I'm sorry. Can I jump
Yep.
in real quick?
Sure.
One thing I meant to say, and I forgot, if you're with the ARC now and you want to stay with the ARC, you don't have to rehire your staff. You don't have to turn in all the PCP and the plan and the family of staff and the participant. I think all you have to do is they want you to copy your budget over to a new budget form and then add in the FMS fees. But so that's the beautiful thing, that you don't have to do all that if you don't want to switch from the ARC. Okay,
But
thanks.
Liz, it is true, you still have to select
You have
the
to
ARC, is that
choose,
true?
Yeah, but you don't have to redo all of the paperwork and rehire all your employees.
It really is key here. If you don't select one of the three, one will be selected for you. So by November 15th, hard and fast deadline, as we've heard, you must actually proactively fill out a form and have your CCS submit it to make your choice known. So everyone has to do that, or one will be chosen for you. So, all right, who's up with EVV?
Okay, so pretty much all I have to say is what's on the slide. It's coming. It's required by a federal law. DDA is saying that it must be done for personal support hours and respite hours, and each FMS will have its own system or app. So it will be done under the new FMS for sure, but the exact start date of when you have to be in compliance is up in the air. It could be as early as October 1st. So that's why you need to pay attention. You need to go to these fairs. You need to ask questions about it and watch for information. If you see anything that says EVV, you need to pay attention, because it's possible if you're not in compliance, your employees won't get paid. And this is what we need to do to protect them and keep them from everybody to be paid. I'm done. Go ahead.
We're trying to get some more information because we meet with DDA on a regular basis, monthly, and actually tomorrow. So we have several polls. I hope you'll hang in with us so we can have some information, factual information, to understand where everybody is and to tailor our conversations in the appropriate way. So Ginger, take it away.
All right. So the very first question is the one that we always ask. We just would like to know who is in the meeting. So hopefully this poll is coming up. Can you see the poll?
No, not yet.
It has launched it, but if it's not showing up.
Do you have to stop sharing the PowerPoint?
I don't think so, but I'll do that. Okay. So let me try again to launch. There we go.
All right.
While you're waiting, let me say, we see all your questions in chat. When the polls are finished, we will be revisiting those questions and trying to answer what we can.
You ready to move on to the next one?
Yep, I was going to give another 15 seconds.
Oh,
We
okay.
still
You
have
have
people.
it. Yep.
Yeah,
Yep.
I'm watching the count, and as soon
Okay.
as. All right, 5 more seconds. Okay. All right. So can everybody see the results, or is that? Okay. So let me go ahead and launch the next poll. Okay, so can you see it?
Yes.
Okay, excellent. So basically, one of the things we want to find out is what percentage of our membership has got expired plans, because that's obviously becoming an issue. And so if you have an expired plan, we're also asking you to put your plan date in the chat, because we're trying to figure out, are we talking a few days? Are we talking a couple of months? That's kind of the information that we're looking for. So anybody who has an expired plan, please add that information of your plan date to the chat. Okay, we'll give it another 15 seconds. Okay, I'm going to end that poll. All right, so then the next thing we want to ask about is clarification requests. And basically, we have heard from our membership that people are getting multiple clarification requests, and in some cases totally new stuff. So instead of all of the clarifications coming at the beginning of the process, you get one, and then you get something totally different, and then you get another one, and it basically is dragging out the process. So that would be very helpful to know. And if you had more than one clarification request, if you could put how many you had in the chat, that would also be helpful.
Can I ask a question? This is Kay. What is a clarification request?
So that is when you submit your PCP and budget, they come back and say, explain this, or, get more details about a particular budget line item request. If any of the support brokers want to add to that, there may be other things.
Okay, thank you.
Okay.
I have a question.
Yeah.
There's already someone that's taking care of the payroll stuff. I am the hire, and there's someone taking care of the payroll stuff.
Yes, the FMSs do most of the payroll work. A lot of that happens behind the scenes, so we don't necessarily always know that, but that's part of when they write the checks and process
the clarification. I'm not sure if I got clarification requests.
Oh, clarifications have nothing to do with payroll. Clarifications are strictly regarding
not just payroll, but maybe even clarification. I meant there may be someone taking care of that.
So your CCS and the team is supposed to work together to answer the clarifications. Is that helpful?
they're supposed to work, a CCS supposed to work together to receive clarifications.
The CCS gets the clarifications, and it's the intent that she share those clarification requests with the team. The team would then discuss the response back to DDA, and the CCS would then respond. Typically, you're supposed to have one set of questions, one set of clarifications to your PCP, your plan, and you're supposed to respond to them. Occasionally, you would have to, make a second request, because second clarification, because something wasn't clear. But
I'm not completely sure the answer,
Well, we can talk about let's we want to keep the meeting running, but if you leave your name and email address and in the chat just to me, Alicia, you can do that and we can talk about it another time. Or if you want to, you can email us at info@maryland.sds, and we'll try to hook you up with the support broker or CCS to fully answer all the questions.
Yeah, I think Adam,
Adam,
it's just when you've submitted your plan and you're trying to get the approval back from DDA, when they'll ask questions like why do you need all this mileage? That's a clarification request. So you may or may not know that happens, because sometimes the CCS will just answer DDA. So if you don't know, just say no, or don't answer that.
I have gotten something where my helper has to fill out, that ask about my helper's mileage.
Right,
so,
right.
Liz,
so yes, then. We got to move on.
You guys can talk outside of the meeting. We can't just do one person's questions.
Right.
And if
thanks
we could
so much.
Questions in the chat, that would be helpful. Okay, so the next question is, did anything in your plan get denied? So that might be, you had to remove something that or that you need in order to get the plan put through. And any details, if you could please put that in the chat. You can put it privately to Self-Directed Advocacy Network, the host, and nobody else will be able to see it if you have details. Or you can email info@marylandsds.org. Okay, can you guys see the poll? It's having trouble launching these polls, so I apologize if...
Can't see the poll.
Okay. It may need to time out and then I can launch it again, and I apologize.
There we go.
There it is. All right.
Do you want to explain this a little?
Okay, so this is where, as part of the process of reviewing the PCP and the budget, something came back from the regional office saying, no, you can't have this. And it was clear that the rest of your budget was not going to get approved until you removed that item. And so we're trying to get a handle on, did anything get denied? And if so, what was it, so that we can then report this to DDA, where things that have been identified as a need are being questioned at the regional office level inappropriately. Okay, we'll give this about 15 more seconds.
May I say something?
Okay, well, just if you could make it quick, because we...
Yeah, it is. The person that was looking over ours told our CCS that we had to take out the transportation reimbursement, even though it was approved in the bill, because it was not approved. And so we had to remove it, or it wouldn't be, the plan would not be approved. And so we were...
we'll talk about this more at there are several other people who have similar questions about out-of-state mileage, and we can handle that.
Oh, it wasn't out of state, it was any mileage.
Jean, the Self-Direction Act is not in effect yet, not until October 1st.
No, I know, but didn't you just say that the mileage was approved July 21st?
In the July, yeah, I did. In the
okay,
July,
that's all I was saying. I'm sorry.
In the July 21st meeting, DDA showed us that was now okay. So as of July 21st, DDA had said in a public meeting that was going to be allowed. So you can go back at this point, I would think.
Yeah, I realized that, but the person denied it. I'm sorry.
So, okay. I highly recommend Christy in this case.
Yeah.
Next.
I will.
And if you can please make sure you put that in the chat so that we can, when we go through and review and tally things, that would be really helpful. Because if it's written down, we'll remember it. And if it's not, hopefully we'll remember it, but we might not. So.
These people will not write down anything, you know,
okay.
with their name on it.
In the chat.
Yes, I know. I'm just saying
okay.
To the CCS.
Okay.
Right,
so
and anything you put in the chat will be anonymous when we share it with DDA.
yes.
Oh, yeah. No, you can put my name. That's okay.
Okay. So the last question that we have is funding for the FMCS. So as Alicia mentioned, this is now something that is going to be in our budget. And the question is, do you have the unallocated funds to pay for that? And what that means is the difference between the bottom line budget when you add up all of your hours and all of, your activities and all of the things that you have paid for, and that big budget line item number. Okay, if you don't understand what these mean, we did have a seminar on the budget. I believe it was April or May. And you can go back and listen to all of that information in great detail that will help you figure that out. But that's something that's important to know is, are you going to have the money available in your budget to be able to pay for this? Okay, we'll give another 10 seconds. Okay, we'll end that about 50-50. All right. Okay, so those were all the polls that we had. So let me bring up the PowerPoint again and okay. Alicia?
Thanks. Does it? Okay, here we go. No, I think it's the one before that. No, all right. Maybe it's the one before that. Do we have one about questions? I thought we had one about questions. Okay, so so let's do a question and answer kind of session here. We did have quite a few questions. Maybe, and I lost my chat version here. Okay, there we go. So the first one was, I think, taken care of. Individual family directed goods and services. Somebody asked, how does one get the money from that? And the money would be from your unallocated funds, or what used to be referred to as savings. So if you have more individual family directed goods and services than you have money for in your current budget, and you need to go back to your CCS and support broker and access that COLA and the increase in the rate. And it would be I guess it's it's a revision of your PCP, but if all the services are the same and you're just getting the money, it should be a fairly simple process, or so we were told on the 21st. We did have one request for anybody who's had some environmental assessments and they like the people. If you could put in the chat who you liked. There's somebody looking for vendors who do that, and we'd like to help people out if we can. Carol, someone asked about awake overnight, and is that included in the 82 hours? Can you talk about that a minute?
If someone needs 24/7 supports, you have to go over 82 hours of personal supports and 40 hours of CDS, because there's a total 168 hours. So DDA is supposed to make an exception to the 82 hours, which is allowed in the waiver.
Thank you. Somebody else is asking about the support broker mandate and what the role of the support broker would be. Do you want to handle that, Liz?
The support broker mandate for when you have family as staff.
Yes.
Yes.
It's so there's an inherent conflict of interest when you have family as staff, and the support broker is in there to help mitigate any conflict of interest that DDA might have us, and to help support you. I mean, a support broker, a good support broker is invaluable. I think that was the reason to have that, because we wanted to expand. We wanted to. Part of the law is they can't take away family as staff, so that was a little bit of a give to get that. Because DDA has for years tried to eliminate family as staff. So, we want that preserved, and the support broker is part of the bundle. So I hope that answers your question.
Question. So if we now have to have a support broker to have staff, to have family as staff, then we're going to need more in our budget for the FMS and more in our budget for a support broker.
Right. But
That is correct.
And we're not sure, it's like traditionally there's funding for support brokers. And I think part of it, we're trying to preserve that at least for that minimum 4 hours. So you have that extra funding. So it's not just coming out of
Currently, DDA regularly finances 4 hours of support broker per month. So that shouldn't actually have to come out of your budget. It would be a service.
Right. It's not coming out of extra, the savings, as they say.
Okay. So there've been a lot of question about reimbursement for mileage. And the answer is yes, DDA reimburses for mileage if it's a staff car, and if they're driving it for the purpose of delivering the services that have been approved in the plan. The additional piece we were talking about was for transportation of a specialized vehicle that was owned by somebody and not driven by a staff member. Would the owner of the vehicle get reimbursement? And we understand that as of July 21st, that is allowable. We also understand that out-of-state mileage, especially, is a little fuzzy, especially in the contiguous states. So if you're in Maryland, Pennsylvania, West Virginia, DC, Virginia, that out-of-state mileage that's part of a person's regular activities, that's the muddy part, is perfectly allowable. So people did have that regularly rejected, and I think any of those people can go back and fairly easily get that added back in. So somebody asked the question, and why are the rates of the FMSs different? And a lot of people were interested in the information fair. So I think what the key here is, there is a range of what the FMS's rates are, and we are very unclear as to whether or not that is the full cost for each one of the FMSs. And so these information fairs are the place to ask all the questions. And I think that is a great question to ask, like, are your fees of each individual FMS, are your fees all inclusive? Is there any additional charges that could possibly happen? And I would ask each one of the three. I understand each one of the three are going to present very briefly, and that there will be a question and answer period for all of these. And I think it's a great question that SDAN doesn't have the answer to. So I highly encourage everybody in all the sessions to ask the question and make sure we get a clear answer from each one of the 3 FMSs. A little more conversation about EVV, please, and who it affects. Carol, you want to do that?
EVV affects any person who has personal supports or respite in their plan. It is required that employees at some point in the future, possibly as early as October 1st, will have to be logging on to the app of whatever FMS you are working with at the time and recording the start and end times of personal support services. Whether that is also going to include other services not under EVV, but the logging on and off of the app is going to depend on talking with each of the FMS and how their system is going to work. But everyone with personal support or respite employees will have to use the EVV system of their FMS provider at some point.
Somebody was asking a question about what kind of device it will be, and I believe each one of the 3 FMSs will have their own way of doing EVV, and so that's another great question for the information fair to ask how that's going to be implemented by each one of the 3, what kind of devices it requires, because we don't have that information at this point. So it's a great question to ask. Somebody else was asking about respite staff not getting mileage, and ladies, anybody, to the best of my ability to understand it, respite staff absolutely could have mileage reimbursement.
Yeah, it's the waiver, I think, changed, and I'd have to go back.
No?
And there was
okay, we'll have to look into that.
Yeah, there was a point at which respite did not include mileage. So if you have a staff person that's working under respite, that you might want to have them work under personal supports until they are back in the house and then switch over to respite. But they do have a place for respite mileage on the budget sheet, but it's my belief that there is no mileage reimbursement in respite. They took that out of the definition, but we'll make a note to check on that.
Yep. That's a good one.
Alicia, this is Meg.
Yeah.
I noted that a couple people in the chat said, I have 10 cents left in my unallocated funds. You know, how am I going to pay? Well, you know, they're implying, how am I going to pay for the FMCS? So one thing people should be aware of it, and maybe I think perhaps a lot of people aren't, are the rate increases that they can access. Have we discussed that? You're muted.
Yeah, I mentioned, I'm sorry.
We did talk about it. We have a slide, and Ginger, I don't know if you want to put the slide up, but there were 2 increases to the rates. They were both effective July 1. One was a COLA increase. There we go. And one was just a straight up rate increase. Most participants who put in their plans prior to July 1 would not have gotten those increased rates as part of your budget. If you did submit a plan after July 1, those increases should have shown up in your budget sheet, in your total amount of your budget. Remember the big number we've been talking about. If you did anything June 30th or before, you may have been able to use the wages, the increase in wages, but you did not get it to take advantage of the increase in rate. And so if you are finding yourself with not enough money to pay the FMCS, then talk to your CCS and your support broker, and you'll do a quick plan mod to address that. So talk to your CCS and support brokers. You know, we can see what is said in the August 1st meeting, see if DDA has any additional information to share with all of us. But that's what we know as of July 21st DDA webinar, is that these increases are there as of July 1, and you are allowed to access them for the FMCS or another need.
Right, and
Does that
in
help?
the July 21st meeting, they explained how, they explained how to, how to revise the plan, how to get that funding increase applied, I believe.
Somebody else is asking.
Yeah, if you're short on money, they explained how to get more, how to add it.
And that meeting was recorded as well, I believe. I haven't tried to access it, but usually they do put them up in the DDA website.
Yeah, we sent an email with the link and the handouts.
Okay,
as
great.
standard.
So somebody was asking a question about Appendix K. The best of my knowledge, Appendix K has been extended through September 30th. I believe that while Appendix K has been extended to the 30th, then the budget mod system that was in use during Appendix K can still be used. Karen, if you know anything different, let me know, but that's my understanding.
We have the same understanding, Leisha. If anything changes, I'm sure DDA will be providing guidance.
Great.
I have a question.
We can't really take the verbal question. So please, unless you really can't use the chat box, please use the chat box so we can keep it flowing. Go ahead, Patty.
Alicia, someone asked about, does EVV take the place of a timesheet?
So I think that's an FMCS question, which I don't know if Karen would want to answer that, but it was definitely a question that you should ask each individual one. But as of now, you can say if you would like. No,
I can take that one.
Okay.
Just briefly, so electronic timekeeping will be required in order to meet EVV compliance, and electronic timekeeping will be the methodology to submit timekeeping entries. So they're kind of one and the same. Electronic timekeeping would be how everyone submits time. Some of those entries will have to meet EVV compliance, depending on the service type. So I think that's personal supports and respite must meet EVV compliance, but it's really a back end compliance. But all the time will be submitted via electronic timekeeping. And the ARC has new software coming out about that. We'll share about that during the provider information fairs.
Thank you. So I think there's some questions about overnight supports. The current system of overnight supports is overnight awake supports and requires, Patty, maybe you're the one to talk about this a little more since you've had some experience with it, either a nursing care plan or a behavior plan. Do you want to give us a little more detail?
Currently, the way that we see DDA approving or not approving overnight supports is they are asking, what is the overnight staff going to be tasked with doing? There has to be something that they are doing, not simply being there. So that's why they're asking for either a behavior plan that would outline interventions that the staff would do, or a nursing care plan. Now, example, nursing care plan could simply be, somebody needs to be repositioned, or they need to be assisted to the bathroom, or they need their blood sugar checked in the middle of the night, something to that effect. So there needs to be something the staff is doing. That's the way DDA is interpreting it now. Now, we do understand that many people simply need some person to be there, not necessarily doing anything, but just in case. That's a gray area, and DDA is not approving that currently. We're in discussions with them, we're talking about it, but that they are approving when there is a need for a staff person to actually be doing something. Okay.
So that's the current situation, and we hope that will be changed as of either October 1 or January 1. So that overnight supports does not require the awake portion, just that somebody be able to get awake. Let's see. I think so we're talking about respite mileage, I think, came up again, and we will check on that and try to post on our Facebook page. Let's see.
Someone asked about
Okay.
EVV and 2-to-1 supports. I'd be really curious to see how that would work, and I'm wondering if Tracy could answer that question, or if there is an answer.
Well, certainly you'd want to ask every ARC, feel free to answer how that's going to go, but you'll want to ask every FMS how that will work. Go ahead. Sorry, ladies.
I can chime in just briefly. I think EVV compliance would work if there is a 2-to-1 ratio allowed for this service. I am not aware of any in self-direction for which it's allowed.
We know 2-to-1 services are happening in self-direction. I mean, I know of one circumstance, but I have no idea how it would work with EVV.
It would have to be allowed in the waiver and the service definition for that to be EVV compliant. Otherwise, they'll only allow one person to bill for that service at a given time per participant.
Okay, it's something that we'll need to check into, I guess, because I know there are, well, somebody else wrote in the chat box, they know person, I doubt it's the same because they're opposite sides of the state, but I know there are people in self-direction who have 2-to-1 staffing, at least for portions of the day, so we'll check.
Does anyone know what the web address is to sign up for the virtual session on 8?
There was,
question.
so there is a, I think it's posted on our Facebook page. DDA sent out a memo to everybody in self-direction. We can try to repost on our Facebook page, or maybe somebody more clever than I can put it. You're going to put it in the chat?
I'll email it to everyone.
We'll email it out to everyone.
Thank you.
All right. With this all 2-to-1. Okay.
I have a question. I'm sorry.
Please put the questions in the chat so we can handle them. I'm reading it as carefully and as quickly as I can.
I just wanted to make a comment about the email. Please, if anybody is not on our mailing list, please join, because that's who we send the emails out to. So if you want to get information about those DDA webinars and live sessions to sign up for, you'll only get those emails if you're on our mailing list. So you can join on our website, marylandsds.org, and there's a join us place up on the menu, and it's simple and it doesn't cost anything, but that's what we use for our mailing list.
Thank you, Ginger. Some people asked for the presentation, and that is posted on that same website if you wanted to see this PowerPoint again. All right. Does everybody understand? I mean, there have been a couple of questions about the unallocated funds. And so just really quickly, Ginger had a really good idea to go back and listen to the budget because it's very clearly worked through there. But when you go through a PCP planning process and you come up with the various services a participant needs, you multiply those hours times a rate and you get a big number budget. From that comes out the wages you're going to pay, mileage reimbursement, various things like that. If you don't use all of the money to fund the necessary services, there may or may not remain a portion of that big number that is unallocated, and it remains there in the participant's name to be used or not used as the year goes along. So that's what the unallocated funds are. I hope that helps a little bit. We talked about the support broker, and somebody asked a question about when you will need to have a support broker if you have family of staff, and I believe Carol answered that in the chat, that that would be a waiver change, and so not until January 1st. So let me see if there's anything else, or if we actually got to the end.
One person noted that they heard at the DDA webinar that if somebody needed to reallocate money, they could reduce the staff wages, but they could not reduce the number of hours that the staff is working, which I'm thinking might be an issue for some people.
I think I heard that same thing. So you would be able to change your benefits package. You'd be able to reduce your mileage reimbursement rate. You'd be able to go ahead and try to get the increase in
Right.
rates. But no, I think it was stated in that meeting. I don't know if they'll stick with it or not, but I do think it was stated in that meeting that you can reduce people's pay, but you can't reduce the number of hours, because those were hours needed. They were needed. So you're not allowed to reduce something that meets the need of the person, which in concept makes a lot of sense. So I would, again, highly encourage people that are tight on the money to go talk to their CCS and support broker, have a team meeting, look at the rates that were used in the PCP and see if there isn't that 8% sitting there that you can access. Generally speaking, in my experience, people don't like a cut and pay. So I feel like that would be a difficult thing for a staff person to swallow. Somebody else was asking about the DDA info about the new COLA, and I don't think they posted anything about it since it's done so differently now. So COLAs are not given the way they used to be. They are an addition to the rate. So it's an increase in the rate. So my understanding is this year, July 1, 2022, there were two separate increases to the rate. One was a 4% COLA increase, and the other was a pure rate increase, which I believe also was 4 or close to 4. So the rate would have increased by approximately 8%. So that, should help. For every $100, that's $8. So that should help people find some funding. Does that, I hope.
Someone else asked about what's allowed in IFDGS, individual and family directed goods and services. And my experience as a support broker tells me that's been pretty inconsistent, and that's something that needs to be addressed with DDA, from region to region, what's allowed and what isn't. And a lot of it appears to be judgment, and it's probably something that needs to be worked on.
Yes, there does appear to be inconsistencies in the region. I think our Facebook page is another great place to pick people's brains potentially, or private message each other to see what the details are. Carol, I think that our bill will allow individual family directed goods and services to be used for more things than currently. Is that correct?
The bill says things allowed by CMS. CMS doesn't have a clear list either. There is no clear list. It's supposed to be things for that assist with community integration. There are other specific things that they mention, like dental stuff is in DDA's waiver. I'm not sure that's in the CMS specifically. So it's just one of those areas where we need to do a lot of advocacy and you have to do justification of why you need it. And when you're denied something, especially if you'd had it before, you need to let us know so that we can advocate as a group.
Someone else is asking about EVV for live-in caregivers and what the rules are and what goes on there.
So that's a great question. At this point, DDA is saying that it applies for the services regardless of whether the person lives with a participant or not. CMS rules memo states that that doesn't have to be that way, but that it's up to the states to decide. So we will see. I mean, it certainly would be a lot easier for people to not have to comply with EVV if for personal supports if they already live with the person. The memo states that if you reside with the person, then you're not really visiting. So it's not actually a visit, and it's not regarded as necessary to comply with the federal law. But again, the states can do what they will. So it is certainly on our agenda to discuss, and any opinions or information that you might have for us to share would be very welcome. Somebody else is asking who is going to install a EVV system, or who's going to, I guess it's really a question of how does it work? So people who've never seen an EVV system, the only thing I know for sure is each individual FMCS is going to have their own system. I believe there's going to be some sort of either mobile phone or internet connection, sort of like a log in, log out system, and they will vary between the three. So again, great questions to ask at the information fairs, because we just don't know.
Alicia,
Anybody who's
you could say folks that have had CFC services
just going to say
have
that,
been doing EVV all along. So this is not new to Maryland. There is a system in place, and you're just going to learn it as the FMCSs provide that information. We would be speculating at this point. So the information will come forward from your FMCS.
Well, that from your, yes, yep. And again, these are information fairs, so these are great questions to ask. How does yours work? How does yours work? How does yours work? So that would be great. Somebody's asking the significance of SIP. Not sure what that is. Okay. All right, I think we've kind of come up to our hour. I think we've hit most of the service implementation plan. Does anybody have anything to say about that? The significance of the service implementation plan?
Hi, this is Paulette. Yes, the service implementation plan was earlier in the year required. The CCSs are now supposed to be doing it. DDA is supposed to be doing a training, but what it does is for the services you were saying how they're going to be implemented, what you're going to be doing.
Gotcha.
Okay.
Gotcha. Yeah, so I think it's definitely a team question.
It's like EVV 2 years ago. One of these days we're going to have to do it.
Yeah, yep, okay. Well, so the big thing to keep in mind about EVV, however it shakes out, is to pay attention, because the answers to the questions, the really good questions that you guys are asking today, the answers to those questions are really important, and that we all know what they are, so we can make sure that our really valuable employees get paid. Because if there is a system implemented and the employee doesn't use it, they risk losing pay. So again, SDAN doesn't know the specifics at this point. We're kind of where you are, waiting to hear. But please, we know enough to say, please pay attention. Pay attention to it because it could be really important. So at this point, I think we should close and let you guys get on with your day. Patty, want to take it away?
Right. Well, there was a whole lot of information shared today, a lot of wonderful questions. I'm not just saying that, they were wonderful questions. It's pretty clear the details are not ironed out yet. So, tune in to every opportunity to learn more. Remember that it's the marathon, not the sprint, and to take, kind of all those sayings, one day at a time. And we will all get through this together and make this transition through this FMCS together. So tune in and we will be back in touch in another month or so. Thanks for attending.
Thanks everyone for coming.
Your donations are much appreciated so we can keep this going. And your time, volunteer.
Thank you.
Thanks again. Have a good one.
Thank you.
May I get the record? I'm sorry, today I'm late. I joined, so I couldn't. Yeah. Can you send me the record?
The recording will be posted on our website in a couple of days.
Website is, do you have a website?
MarylandSDS.org.
Maryland.
S like Sam, D like David, S like Sam, .org.
I just put it in the chat.
.org.
Yep,
Oh yeah,
it's in the chat, the very last thing. www.marylandsds.org. You can copy probably and copy it from the chat.
Okay, thank you.
Yep, have a good one.
Thank you, thank you. And could you and could you show me the questions again? I didn't see the questions.
If you're talking about the polls, we really can't redo them. But thanks a lot for coming, and feel free to email us at info@marylandsds.org, and we'll try to respond to you as quickly as we can. Thanks.
Okay, thank you.
All right. I love that. Put people in the waiting room thing.
Could you feel it? Could you feel how wound up people were?
Oh yeah.
I'm wound up.
I'm not. Remember, it's just one in a series.
Right. It's just